Welcome to Innersight, Health Optimization with Rudy and Shaun.
Right, and off we go, Shaun. Podcast number 26. So we thought we'll bring it back just between the two of us because we've seen quite a few clients again, and there's a few questions. And after quite a lot of people looking at our creatine podcast, we thought we'll bring it into the realm of supplements.
Thanks, Rudy. Yes, a bit under the weather, but I think we'll try and make this one. Yes, and I think we had a discussion about this, and supplements is such a big field. I mean, it's so we've decided to narrow it down slightly, and we're going to talk about the supplements regarding muscle, bone, and brain, and focus a little bit in that sense on those supplements. We might touch on some of the other supplements, but try and speak about supplements in general is such a big field. So we're going to try and narrow it down slightly.
Yeah, we've had a month of trying to look through all supplements people are taking, and a lot of people ask us, but I'm taking this and this, and it's difficult. So we believe that to get old and get old well, you need three things. You need a brain, you need strong bones, and you need strong muscles. So we're going to go through and try and look and see what will make you keep those and what should you probably supplement with. And if there are fringe supplements, we will touch on them. And if we do not touch on them here, then there's probably not enough evidence for us either not to test them or to take them.
Yeah, and I think the main message today is about preservation of muscle, bone and brain, and we're not necessarily referring to the young person of 20 plus years. This is more in the age group of 50 plus that we'll be discussing in the sense of supplementation.
Okay, let's start then. We're going to start with muscle. I think muscle is one of the main things that we focus on in our Innersight 1 program. So muscle we test in our Innersight 1 program in quite a few ways. We test it in what you can do in your flexibility, also with your stability, and then strength. So we obviously test grip strength. We test strength in doing push-ups and squats. And I think that's probably one of the things that you can supplement quite a bit with. So
absolutely, and I think we need to think of muscle more than just power. It's an actual endocrine organ almost, and the literature it's clear. If you just take something as simple as a grip test, strength test, it's shown to, if you've got a low grip strength, then you've got a higher incidence of cardiac and non-cardiac incidents. And so there's also a lot of studies on muscle mass in older people that even if corrected for BMI, it shows if you've got more muscle mass, your all-cause mortality is lower. So it's a very, very important part of aging healthy, if I can put it that way.
And I think people need to realize why it is such an important marker, because like VO2 max, it's a proxy for what you are doing in your life. You are picking up heavy stuff, you are walking around doing things, and that means you are a fit person. But let's come back to the supplements. So we touched on that we want to do testing. So both our first one, if we think about creatine and about protein, we can't really test for. So it is we go by numbers. So, I mean, if we think about creatine, we've discussed that in the previous one, and we do think we should take creatine.
Yeah, so I mean, we've done a whole podcast on creatine, and it's that quick energy that you get from the creatine. So what effectively it does, it helps you with your exercise. It helps you to better exercise, it helps you to get better gains from your exercise. And it's definitely beneficial, and it's shown, especially in older people, to provide some lean muscle mass improvements when you take some creatine.
Okay, so let's say yes, for creatine. So we're going to take it. It helps with energy, muscle mass, and also brain, but we'll get to the brain later. Now we're going to say we can't really test how much. We know the body makes about 0.1 gram. So as I say to people when they ask me, just take your body weight and divide it by 10. That's what the body pretty much in grams make itself every day in creatine, and we can supplement basically the same amount.
Yeah, so it's a general rule, 3 to 5 grams is the general rule out there to take per day, grams per day. But as you said, if you weigh 80 kilos, you'll probably need to take 8 grams for the creatine. And it's more important for older people. I mean, with the creatine, you can take it at any age, depending your goal. I mean, if your goal is preservation of muscle mass and you're an older person, this is one of the things that you can use to help you with that.
And that's actually one of the nice things where supplementation helps the ladies a little bit more than the men, especially in South Africa where the men eat a lot of red meat and maybe ladies not that much. The supplementation here will help a lot more. So ladies, please think about it. You guys do much better with the creatine supplementation. And there seems to be about 2 pounds, 1 kilogram, between 0.5 and 1 kilogram in water retention in the beginning, which will probably stabilize, but that is water being pulled into the muscle. So please don't think it makes you gain weight as fat. It is water, and no need to load. Just start taking it at maybe for the ladies around 3 to 5 grams, and then your energy. And most ladies also do respond and report that they do have quite a boost.
Yeah, so they rather put the scale away. If they want to do something, they can do an in-body scan, which gives you percentages of body water and muscle. And you'll actually, after starting creatine, it will look better. Your results will look better on an in-body scan because of the extra water that you retain from that. And your lean body mass will increase with that. So it's much better than just a number on a scale.
Good. Okay. We can keep going with creatine, but let's park it there and let's move on to protein. Protein and leucine is the next two that we want to maybe touch on. Protein, again, building block of muscle, and most people do need to supplement for a few reasons. Number one, you need the proteins to build the muscle, and the other part is to feel full when you eat, that you actually supplement with a little bit of protein and don't feel like you have to keep eating. So
yeah, and the main thing is when we get older, from 50 above, we become a little bit anabolic resistant to protein. So you need higher dosages of protein just to maintain your muscle. I'm not even talking about building muscles, just to maintain your muscle, which is very different from a 20-year-old. So we're specifically looking at the 50-plus group now, and you'll need about 1.2 to 1.6 grams per kilo of protein a day to keep your muscle.
And just to touch on that, I mean, people need to realize that your stomach changes as you get older. So, I mean, things like vitamin B12 and all that gets absorbed differently. So protein the same. So I think we need to stress that people need to take extra protein, especially as they get older. And make sure that they have those numbers in their head, because it is quite difficult to get that numbers. I mean, if you think about an egg is about 8 grams of protein. So, and we just said that you need about 1 gram per kilogram of body weight at least. So if you weigh 80 kilograms, you need 10 eggs extra a day for supplementation. So that's a lot. You need to...
Yeah, and I think the reality then is that often we need to supplement. We've got options of supplementing protein. The most common one is a type of whey protein. But you also get essential amino acids that you can supplement with. And we can have a talk about that. The difference between the two. But I think with one thing that you need to keep in mind, when we say you need to increase your protein, we don't mean that you need to increase your calories. Okay, so it doesn't mean that you're eating more now. You need to increase your protein ratio in your diet. So it might mean that you need to cut down on some of the others. Otherwise, you're going to be in a position where you might gain weight in a way that you don't want to gain weight.
Yeah, so I want to move one step back again. So we said protein supplementation. So we can either do whey proteins, which is normally milk derived, or from one of those products. You get the pea protein, which is for the vegetarians, comes from a plant source. And then obviously we talk about, you see on the little tubs where they say BCAAs or branched chain amino acids. Just for the science out there, scientists out there, the science of that is like amino acids are the building blocks of protein. So, and you need all those amino acids to build protein, but there are 9 of those essential amino acids, as they're called, that our body doesn't make itself. So you need to bring those in. And that's why sometimes it's good to take branched chain amino acids if you're not feeling like taking protein, because that is the building blocks that you're actually taking.
Yeah, so I think in the scenario that you might be on a vegan or vegetarian diet, you'll probably go for a pea protein type of thing, because to get it through your diet, it's going to be very difficult to get that amount of protein in your diet without increasing your calories. Okay. Something like the whey protein is very nice because you get that full sensation, so it does help a little bit with the hunger, but you can get some calories in with it, and that's where the essential amino acids is quite nice, because you don't get any calories with those. So if you want to up your protein without the calories, that's where you can use essential amino acids quite nicely. And you need to put it in perspective, like 5 grams of essential amino acids equals to about 20 grams of whey protein, just to put it in perspective, more or less.
Yeah, and all these things are so linked. I mean, if we think about to build a protein, what you need. I mean, we have had a whole podcast about iron. We haven't spoken about vitamin C yet. So all these things fit together to make both proteins, and then the other side that people always ask is collagen. So maybe we should touch on collagen and where it fits around a muscle and protein. So because we get asked, but should I supplement with collagen? So, and I think maybe we should go to the back a step and say, let's talk about the pyramid of the basics that you need to have. And if you don't have enough iron in your system, so especially here with the ladies again, we need to say we've had 2 podcasts about iron now. That is something we definitely can test for, and if it is a supplement you can buy over the counter, but you need to know what your levels are before you supplement. But up to 50% of women in the Western Cape are iron deficient. So if you have an iron deficiency and you take collagen, it's going to do very little to form the right collagen for yourself. So that proline to hydroxyproline will not happen if you do not have iron and vitamin C in that process. So
no, absolutely. So the collagen would mostly be the type 1 and 3 for tendons and cartilage. The type 2 is more for skin. So there's some studies that shows like that you do get some pain relief if you've got some arthritis type of condition, like osteoarthritis from taking the collagen. And there's a couple of studies showing that it might increase some bone density if you take it with, but we'll have say something about that as well. But that can be part of your diet as well. You can include it in your diet, depending on your goal again and where you lack. So you need to go see what exactly you need. It's not the umbrella type of thing that you'll do.
And I think now you can start, I think the listeners can start see how difficult this supplementation is, because we're talking about strength, but in the strength, the muscle is there, but around it are all these fibrous tissues, and you've got a tendon and you've got ligaments, which is now the collagen side. It's not all just protein, but so we said creatine, definite yes. Protein, definite yes. Collagen, maybe. Maybe we should then in that sense talk about omega-3s.
Yeah, I think there's two. There's omega-3s and the vitamin D is the two maybes that also fit into that equation. So, yeah, we can maybe start off with just saying something about the omega-3s. And this is now in the context of muscle preservation. So in the aging process, people probably heard of the term inflammaging, because there's also a degree of inflammation as we age, and the omega-3s help nicely to reduce some of that inflammation, and because inflammation puts you more or less in the catabolic state, so it's difficult to build muscle in a state where there's a lot of inflammation.
Yeah, but what I like about the omega-3 then is if you're unsure if you need to take any, is that you can actually test that. So that's because we are all for testing and only doing things that are scientifically proven and that you've tested before. So if you are unsure, there is a test that you can run for omega-3s. It is quite expensive, but it is possible.
No, it's available, and we most certainly can do it. And that gives you some insight into your omega-3 levels.
Yeah, and the diets like the Mediterranean diet will then be high in omega-3s, and that's one of the reasons is it's an anti-inflammatory type diet. So yeah,
and then again, it depends on your diet as well, depending on how much fish you get into your diet and things like that. So it's not the first thing that you're going to jump to for muscle preservation, but it's one of the things to think about.
Okay, let's move on to vitamin D, or it's actually a hormone. It's actually not a vitamin, but it's been misnamed in the past. But that's something we definitely test for and definitely do supplement. Again, it lies more in the triangle of calcium, magnesium, and vitamin D, but it does help with muscle preservation as well.
Yes, and there's an interesting study that I read the other day stating that, we're talking about the age group where a lot of people are on hormonal replacement therapy, in the sense testosterone. And if you low in vitamin D, you won't get the benefit from the T. So it's an essential element in the whole loop of building muscle.
Yeah, so in that sense, we have done a podcast about testosterone. We do supplement testosterone in quite a few men, but this brings us back. The things that you can test for, try and get the test so that you know your numbers. I mean, that's another saying that we've got is know your numbers. So know your numbers of your vitamin D3. And that's another thing now that we say D3, because a lot of the older prescriptions used to be calciferol or D2. And then the people used to come there and they used to say, but I take this tablet every week. But that's D2, where the absorption is actually quite bad. So if you see your grandmother or your mother have the calciferol or D2, 50,000 units per week, you should probably get them to be changed to D3, and then we probably on that have to add Vit K.
Yeah. So, but vitamin D, it's like, I think it's one of those things. It's like iron. You should know your number. I mean, you should know what your level is like, and we aim for about 40 to 60 in our levels, more or less. And we use different units than the US, so sometimes you'll see, and a lot of people will come to you about, yes, I saw this on Instagram or something, but the level should be about 100. They use different measurement levels. So for us, if you convert it, it's about 40 to 60, the sweet spot where we want you. You can adjust it. We can work out exactly how much you need and adjust it. People absorb vitamin D differently. Like there's some genetic variations in your makeup, and you might need a higher dose. So yet again, you need to test, and then you need to retest to see if what you're taking is good enough. Because some people might need more than others to get them to the ideal level.
And I think that's precisely what you say. You need to know that numbers, because I mean you do make vitamin D3 yourself. So sun is actually the one thing that you need. But people think that in sunny South Africa they will have this high vitamin D level. But I mean the saying of 30 minutes in the mid-morning sun with an exposed torso every day, most people do not do that, and that shows in our numbers. I mean, I think of the last 50 people we've tested in Innersight 1, I think only one person had a normal outright normal vitamin D level, most people are deficient.
Yeah, I must say that was the one thing that actually shocked me completely. It's like I didn't realize that like almost everyone is low in vitamin D in South Africa. Because we just brainwashed about sunny South Africa. We would think it would be normal, but it isn't. We're testing people. It's not normal. Most people are low.
Yeah, and most people use SPF. We've been drilled that SPF or sun protection factor, everyone uses a cream. But the moment you use a cream with the SPF above 10, you're not making enough D3. So, and it's got quite a big spectrum. So we said 40 to 60 is what we aim for. Over 100 is toxic. So, but most people fall under the 21 level, which is suboptimal. So we need, I think, if someone takes nothing away from today and maybe just get your vitamin D3 level tested. So because that...
Yeah, and I think there's also a difference between deficient and optimal. Okay, so deficient, once you're below 20, that's deficient. You've got a problem. But optimal is not like 30. Optimal is more towards the 40 to 60 range. So, yeah.
Yeah, I think the two things that stand out there is iron the same. So iron... The lab values will tell you that 30 is deficient, but 300 is too much. But as we had in our previous podcast with Claire, was 100 is optimal. So bring that back to the lab values that we can get and that we do test is that there's deficient. That means your body is not functioning like it should. And then optimal, and then obviously going over the top and being super high, yeah, which is too much, yeah, or toxic. Having said that about iron, I think we must just, again, for our men, because a lot of them are too high, not just supplement iron without knowing the numbers. Just put that caveat in there that men should not just take, or most of the vitamin Ds and the iron should not take it over the counter, because you can buy it over the counter, but unless you know your numbers.
No, absolutely agree 100%.
Which is different to the creatine and also to protein, which you can take because, I mean, most of us do not get enough, and it's not dangerous as such for you to take too much.
Yeah.
Good. Okay, let's move on. Let's try and move to bone, because we have touched on quite a bit of what bone supplements would be and how to keep bone strength. So again, we can measure bone. So we can measure bone density, and that's something you can do on a DEXA scan.
Yes, and I think bone it's your framework. You know, it's the framework where the muscle needs to attach. It's there for mobility and everything else. And we can measure the density, as you said, with the DEXA scan. But I think more importantly is what happens if you break a bone after 50. If you get a hip fracture or spinal fracture, I mean, the stats is hip fractures, there's a 30% mortality with a hip fracture. 50% of people will never get back to baseline after a hip fracture, and it goes on and on and on. So it's definitely one of the most important things in longevity and a healthy health span as such, and very important. And we need to do whatever we can to preserve bone mass as much as possible, and even more so for the females.
And I think also what's come out in the last few years is that your stem cells actually grow inside bone. In your flat bones, people have heard the words PRP, all that. I mean, you need those bones to grow stem cells. So if we look at what to supplement, we need to think, okay, but what is bone made of, and can we actually supplement to make it better, or can it be tested? So I think let's go back to vitamin D. Vitamin D, we've talked about, have it tested, but maybe we should just say how it orchestrates the magnesium, calcium.
So obviously the vitamin D helps with the absorption of calcium from the gut. So that's the main thing the vitamin D does for bone health. I think there was a couple of studies came out, and there were some concerns about vitamin D supplementation and actually getting that calcium not into the bone but into the arteries, causing calcifications in the arteries. So there's one study that I've actually looked at, showed like a dosage of 4,000 units, 400 units, 4,000 units, 10,000 units. And that study, a big study, but didn't show any calcification. So maybe it's not that important, but you can combine it with vitamin K2, okay, to try and get around that equation. Because vitamin K2 then will activate, I think it's osteoclastin or something, that will pull the calcium into the bone matrix. So you use the two together usually in most of the cases.
Okay, and maybe we should just put some numbers to that. So the D3, your body needs around 4,000 international units per day, of which you do make a bit yourself. So we seem to think somewhere between 1,000 and 2,000 international units supplementation is what we see our clients work well on, but you can take a little bit more, and it's not something you need to take every day. And while you were talking, I was also thinking we haven't touched on multivits, but I mean, that is probably our same message with multivits is you probably no need to take it every day. It's a supplementation. It's not a bank that you have to take it every day. So, and just to come back to D3 then is that we do think most people need to supplement with a little bit, but it doesn't have to be every day. You can have little spikes. Maybe two times a week, maybe once a week, but however your system works.
Yeah, and I think, I mean, it's shown that the vitamin D and K2 combination improves bone density in some studies. And in women, they can lose up to 20% of their bone density after menopause in that 5 to 7 years after menopause. And that's especially the group where it will have quite a big benefit. We're talking about supplements as such, but we mustn't forget estrogen as it's not a supplement, but I mean that's part of the equation, because part of the reason why especially women lose such a lot of bone density is due to the lack of estrogen post menopause.
Yeah, and I mean we've had Marlena, Dr. De Tooy on one of the previous podcasts, and that is clear. And again, it's like iron, it's like testosterone, estrogen. You need the bottom of that pyramid correct first. You need to have estrogen in the background for the calcium, magnesium, Fit K to work. You need to have testosterone in the background for the protein, for the creatine, for to work to make your muscles stronger. So your physiological base need to be proper before supplementation works. And I think maybe that must be our biggest message is we think of supplements as supplements, not as it has to be done every day.
I think our outlook is very focused supplementation. You need to see what you need and you need to supplement that, and you need to see the whole picture to know exactly what you need. And testing.
Yeah. Okay. We've talked about vitamin D, calcium. We're not overly concerned about most of our clients have got pretty good diet, so we are not that keen on calcium supplementation on its own without major deficits. So we're probably going to get, or we're definitely going to get one of the osteoporosis specialists in soon, and then we can talk about that calcium. But we per se don't really prescribe calcium as a supplement.
Yeah, I think depending on the scenario, but when we do this podcast on osteoporosis, then there's a definite place for that. But in general, preservation of bone health and things like that, that's not the number one thing we'll do. I think most of our clients' diet will get enough calcium in the diet. But it's something to mention, and we'll dive deeper into that when we go into the osteoporosis podcast.
Okay, and then let's move on to magnesium. We do think magnesium supplementation is probably a good thing in most people, so we both take it. And
I think magnesium. I think most people low in magnesium. I mean, if you look at the literature, it seems that most people are low in magnesium. We take it. It's got other benefits as well. It's very important for bone health. I mean, in the whole absorption and getting the calcium into the bone and everything, it's very important in bone health. But it also helps with other things, and we often use it for sleep, to help aid people with sleep. So yes, we like magnesium as a supplement.
Yeah, and I think maybe for us then, just jumping to the brain side, so the brain, we're going to talk about brain supplementations next, but it falls in between there, because we've probably got to say, okay, but there are few magnesiums, and people have got to understand magnesium, otherwise they're going to supplement with the wrong magnesium at the wrong time. So in South Africa, we've pretty much got magnesium glycinate and magnesium threonate that we think is good to take to help with sleep, but people should not then take your magnesium carbonate or magnesium citrate or chelate in the nighttime, because they will stimulate you. So, and I think for our people that take CalMag or one of the magnesiums, they just got to look on the back of your of the box just to see what is in there. So our magnesium glycinate, I'm going to say it again, magnesium glycinate and threonate are the magnesiums that you can take at nighttime to help you sleep, and then the magnesium carbonate, chelate, or citrate are the ones that you take in the morning, which can help you a little bit with energy. Yeah. And that's the slow mags and those guys. They are normally morning stuff instead of evening. So, okay. I think we're moving along. So we've talked about supplementation. So we do say protein, we do say creatine, and all the other things so far we said please test. Get a number, except for magnesium, because magnesium's blood test is very unreliable. If it's low, very low, it's not always that it'll be low in the blood test. So we don't test for that. We normally say you can supplement, especially at nighttime. Okay, that brings us to the brain. So, yeah.
Yeah, so at the end of the day, that's probably the most important part, is the brain. It's who you are. Without the brain, living longer, living healthier doesn't mean anything. And I think there's a couple of supplements that might help, especially if you've got a history of family history of possible dementias and things in the family. Then you'll use whatever you can to help you.
And I think that brings us back. We had a little bit of a touch with the muscle, but we do think omega-3s is something that helps with your brain health, and we do not test specifically for omega-3s just because it's such a expensive test as a startup. But we can, and we have tested before to see where people's omega-3s are. But what we do is we use a proxy for brain inflammation that we test for.
Yeah. So obviously when you see people for the first time, you do a lot of tests, and then you've got a lot of red flags that you first need to try and fix. So as we move down or longer in our program, then we might get to a point where we actually want to test that. But as a first step, no, we don't usually test.
Okay, so we test the homocysteine, which is a proxy for brain inflammation. That's and so for us then, for supplementation, using that proxy of homocysteine, we think there's two big things that if you have brain inflammation, obviously the omega-3s that we then would supplement, and then B12 is the other one. So and for those two, there are some good studies around that say if you are deficient in both or either, that you can actually with supplementation reduce your risk of dementia.
No, absolutely. And with the homocysteine, it's the B12 B6 and thiamine that's involved with that. So that's a nice screening test that gives you like a little insight in your methylated B vitamins. And we definitely want that level. Usually for cardiovascular health, we'll say, okay, below 10 is okay. But for if you've got a history of dementia in the family, we'll go for below 8 on the homocysteine as a reference point of treatment there. And you're right, your studies clearly show that there's a massive benefit if you do supplement if you are low.
Yeah, and again, it comes to supplementation versus taking stuff all the time. So, I mean, most people's diet is not that stable that they can say, but I follow a Mediterranean diet all the time. So, omega-3s might be something to think about in your supplementation. And then with your B vitamins, you can actually test.
And there's two parts to the omega. So it's that the EPA and the DHA. So with the one, it's more for the building blocks of the brain, if we can put it that way. And the other one, the EPA, is more for anti-inflammatory effect that it enhances in the brain, which is quite nice. But you need both of them for adequate results.
And I'm going to jump back again and say, but if your diet is good enough, then all this is pretty much, you don't need to supplement, but we need to make sure that the diet is good enough in the background. If you are unsure, you can have a test and get your acid tested. So, and I think, again, it's one of those things, if you want to know your numbers, don't just jump in and do everything at this or at the same time in the beginning. You can, but just take a stepwise approach and say, okay, but I'm going to build my pyramid. I'm going to know that my hormones are good. My iron is in a good level. I do think vitamin C is something that's very important. And it's not something you can test, but then you move up in that pyramid and try and knock away the things that you know are low and then supplement them. So
yeah, so I think, I mean, the supplement industry is massive. It's billions of dollars. I know there's a lot of hype. There's a lot of influencers trying to sell products on the internet. But also for an industry to be that big, some people must benefit. Otherwise, it wouldn't have been that big. The problem, though, is that a lot of people, as you said, the first thing they want to do is they want to supplement. That's the thing. They want to know, what supplement must I take, without having the base figured out. It is so important to do a proper testing and then rather do a focused type of supplementation than a overall supplementation. I think people need to understand that the multivitamin as such, you get water-soluble vitamins, you get fat-soluble vitamins, you've got some other adaptogens and things that people put in these multivitamins. And over time, it can accumulate. And if you're not deficient on those, it might cause side effects. So to take it every day might cause problems. So if you're not going to do a focus approach where you actually test it, or you know you're deficient in something specific, or you want to target a specific thing like building muscle, then you shouldn't just do a blanket supplementation regime. That's not the ideal way of doing it.
Okay, and I think we're coming back to knowing your numbers. So, and if we want to look at the B vitamins, we talked about the B vitamins with the brain. So the B vitamins you can actually test for, especially folate and B12 is something, again, we do not do as a base when we do our Innersight 1 testing. But it is something you can definitely test for. And
yes, but we also pick it up through our homocysteine. So
yeah. So we're doing a proxy, but we're not doing the absolute value. But it is actually something you can have an absolute value for, but we're using the proxy of homocysteine for what we test for. And coming back to that, if you are unsure about your B vitamins, you can actually do a test, and there's, again, reference values. And we like to keep our people on the higher edge of the reference values, because the problem with when those values were set, almost like with vitamin C, is people knew they were deficient when they had scurvy, but that was where the values were made, the NDA values. So you want to make sure that you do not get side effects or symptoms. You want to supplement enough, but not too much.
No, absolutely. That deficient versus optimal versus toxic, always in the optimal range. That's what we're aiming for.
And okay, so now we've built the picture to say, okay, but we think this is around what we do think you should think about as a base. Okay, so maybe we should touch on something now that the Tour de France has just finished. Something that's quite interesting is beta hydroxybutyrate. This is outside of the scope of what we normally do, but it is something we get asked about. So beta hydroxybutyrate as an exogenous or ketones, exogenous ketone, as people call it. It's quite an interesting substance. So, yeah.
Yeah, so for muscle preservation, in that sense, there's studies showing that in bedridden people, if they supplement them with it helps maintaining the muscle. They lose less muscle because they are bedridden. So it does have an effect on muscle preservation. And it's shown some benefit in older people if you supplement with it.
And that's quite interesting. That's probably why you see the guys at the end of the Tour de France stage take that little bottle. It's been said that that's ketones, and maybe that is the reason. So it's not 100% clear in the literature, but it's something we thought we would just touch on because, yeah, like I say, it's not something we specifically say that people should take, but it is in the background. And for the reason we talk about intermittent fasting, so you're actually making your own beta hydroxybutyrate. If you fast for longer than 8 hours, you start making that. So it's an interesting substance, and it is made by the body itself. So yeah,
very clean fuel.
Yeah, and the longer you fast, so if you do a water fast of about 3 days, you will run pretty much exclusively on ketones, and a lot of people speak about the alive brain, and because they've got that energy from the beta hydroxybutyrate.
Yeah, so if we talk about the preservation of muscle, bone, and brain, there's one thing that's obvious. They're all interconnected. I mean, if you're unwell and you've got hypertension, diabetes, things like that, that's going to have an effect on your brain. And it might have an effect on your muscle. They're all interconnected. But the one thing that's common in all three of them is that exercise. So the best supplement we can do is actually iron in the form of a dumbbell. It's exercising, which will give you the benefit for the muscle, for the bones, and for the brain. So supplementation helps, but it's not the all. You need to look at other options first before you go into supplementation.
And I think the other side of that is if you do exercise, that'll also show you if you are deficient in something that you can supplement, because that's the other part is just taking protein and you're not exercising, make you feel full, but you're not going to use the protein. The body's not asking for it at that point. Almost the same with creatine, with the small exception of the brain. The creatine will bring in the muscle, the water, and the energy, but you're not going to use it if you do not exercise. And almost the same as with your brain. If you do not exercise your brain, if you just sit at home doing nothing and you're not actually stimulating that brain, it's not going to ask for more building blocks. So, and thank you for bringing that up. I think people need to understand just supplementing for the sake of supplementing is not the right way. You need to have a focused approach and say, okay, but this is the reason why I'm supplementing.
No, absolutely. You can't do a blanket supplementation as such. And as I mentioned previously with the with a multivit, often we can't test everything in the vitamins, and you don't know if you're going to go high or low. And the idea is to supplement. So if you want to do, or if you want to go that route, the best way is to pulse it. So you're going to take some supplements for a period, maybe when you know you're going to go through a stressful period, there's exams coming up, or there's year-end meetings or whatever. You might feel that your body needs something a little bit more than normal because you're going to have more stress in the body. Then you might go on a multivitamin supplementation for that period of time, and then you stop it and you go off it. I don't think you should be on it permanently, but that's a very blanket idea of how you could do it if you don't necessarily have access to specific testing.
And I think that's such a good way to look at it. I mean, even creatine, you should have a cycle. So you should have, let's say, every 4 months, stop taking it for a little bit and then cycle it a little bit. Again, the same with protein, just because otherwise your body gets used to what you're doing every day. So just make it look for it again. And it's a good thing we're not sponsored by anyone, because we're probably not making money for the vitamin people out there. But you do need supplementation, but you need to have it focused. So yeah.
Yeah, focus supplementation. I think that's a message at the end of the day. Some of these consumer genetic tests, they can test for certain pathways, which might suggest certain vitamins or minerals that you might be low in. And that might be helpful sometimes to know you might be low in vitamin C or your pathways, or you've got one of the little snippets missing in the vitamin D pathway, which basically, at the end of the day, you still need to test, because you still need to test to see if your the level of your vitamin D. But at least you know that there might be the possibility that your vitamin D might be low. So sometimes people come in with those tests to us before they've done everything else. So there's sometimes a little bit of pulls in that test that you can use, but at the end of the day, we still need to test to make sure.
Yeah. And I think we're probably going around the same circle now, and I think maybe we should leave it there and say to the people out there, we've got a very structured approach how we get to what we think you should take, and it brings us back to know your numbers, know who you are, get some numbers out there, and when you speak to us, just say, but what about this? Because I mean, we've had a few people that were taking things that we didn't even know existed, and then we had to go read up and find out, and we didn't stop them, but we said it's your choice. So.
Yeah. So to summarize, for preservation of muscle, bone, and brain, we've basically, you can count it on your one hand. It's basically protein, creatine, omega-3s, vitamin D. Those are the main ones that you should focus on, and a little bit of magnesium. The others are not the essential part of it.
Do your testing and see if you do need them, or do a proxy test and see if you do need them. But blanket testing probably, or blanket supplementation probably not the way to go.
Agreed, 100%.
Great. Thanks for coming out again, and it was good to sit with you, and I think hopefully our listeners got something out of this.
Thanks, Rudy. Now I can take my vitamin C and zinc and recover from this flu.
Right. Cheers. See you next month.
Bye.
Disclaimer. This podcast is not intended as a substitute for the advice of your healthcare provider. No doctor-patient relationship has been formed through this podcast. The content here is for information purposes only.